Women are the driving force of a society, and with this vital role comes unique challenges throughout a woman's life. That is why it is important to prioritize preventive care for a healthier future. I am Dr. Faith Popola, Head of Medical Services, Cube Cover. I would like to ask you a question. When last did you do a full body checkup? While you're thinking about the answer to the question I just asked, it is important for us to know that many factors contribute to the well-being or the sickness of a woman's health. And so, factors such as reproductive factors, the social economic factors, financial factors, mental, family, so many things contribute to the quality of a woman's health. For example, balanced diet, exercise. Many women don't have time due to their responsibilities to take these two major things into consideration. It is important to do meal preps. Make sure you know what you're putting into your body. Don't just grab something off the shelf just because you're busy. Exercise is important to maintain so many things that go on in your body biologically, like your hormones. It helps your mood. It helps your productivity at work and at home, and it helps your overall mental state. Your mental health is a very vital part of your well-being. So many things can put pressure on a woman in life, and that can lead to, believe you me, depression, anxiety, and even the eating disorders. So it is important to put into consideration your health, your mental state. Always have someone you can talk to. If you feel you can't trust the people around you, go with professionals, psychologists, psychiatrists, counselors that have been devoted and given an oath of confidentiality. But don't keep things bottled up, because the pressures of the economy, the pressures of having to please the society, the pressures of society and expectation of society on a woman is very heavy. Your mental state is important. And like I said before, nutrition, exercise also affects the hormones that affect your mental state, which brings out who you really are, your attitude, your way of response, your way of solving conflicts. It is important to put yourself first before putting others first, especially in the mental aspect of your health. Now, let us talk about preventive care. Talking about preventive care, there are two major screenings I would like to talk about, very unique to women. The first is breast cancer. What is breast cancer? It is a tumor that grows in the breast. Sometimes it can be benign, meaning it's just a growth, it can be removed, it cannot lead to complications in health and life. And then for the cancerous ones, those ones can spread. But the truth is, early detection is the key. With the information and technology we have now, we have the ability to curb the complications of the spread of cancer in the body and save the life. What equipment are we talking about? We have a mammogram, we have the MRI, we have a scan, and we have many others. But let us talk about the screening process. From the age of 40 up to the age of 74, a mammogram can be conducted every 2 years. And that is if nothing is seen in the breast, if no growth is seen or suspected in the breast. And from there on, if something is suspected, the person can go on to do an MRI and then biopsy and then surgical intervention. It all depends on the results. But every 2 years, especially in someone that doesn't have a history of breast cancer in the family, the person can go on that screening, do a mammogram, and find out if something is there. But if there is history of breast cancer in the family, they have to come in much earlier, at the age of 30. So that is the key to a long life. So having cancer doesn't necessarily mean a death sentence. It can be prevented. Let's bring it closer to ourselves. There is a 6-step on how to perform self-examination of your breast. You can find it in our platform. You can find it many places on the internet. So before the involvement of an external factor like the doctor, you can know some changes, if there are, on your breast or whatever is going on in your body. So this is why we're talking about self-awareness. The next screening I would like to talk about will be cervical cancer screening. Another cancer word, I know, but it's not a death sentence if caught very early. What is cervical cancer? Cancer of the cervix, period. And it can be found only in females. Now, there are no early signs. That's the dangerous thing about this kind of cancer. There are no early signs. But at the later stages, you have bleeding, you have painful sex, and many others. And the funny thing about this cancer is, when it's discovered, it is already late, which is why this screening is very interesting to listen to. Now, good news. There is a vaccine to prevent this kind of cancer. It's called the HPV vaccine. HPV meaning human papilloma virus vaccine, which is the virus that causes this cancer. And it can be administered to children as young as 9 years old, girls as young as 9 years of age to 26 years of age. We have different classes of this vaccine. We have the Cervarix, we have Gardasil 4, which covers 4 strains of the virus, and we have Gardasil 9, which covers 9 strains, just like the name is. And once it's administered, well, we can't say, okay, it's never going to happen. But, once this young lady or this young woman reaches the age of 21, we can start doing something we call a pap smear. A pap smear takes a little bit of the cells. Under the microscope, we find if they are cancerous cells. Can be done every 3 to 5 years. Once it is caught, the chance of survival is very high. It is important to know that this can be sexually transmitted. Yes, this virus can be found in sperm. So, number 1 risk factor is exposure to sperm. It is good to take preventive measures against sexually transmitted diseases. Now, these are not the only 2 screenings available. There are many other screenings, but these are the most common and very important. The many others can be colon cancer screening, which can be done every 10 years in elderly women 45 and above. Other checkups like your thyroid function, other checkups like skin care, dental care. Prioritize yourselves, women. Put yourself first. Check your blood pressure. Check your blood sugar. Check your cholesterol. Like I said in the beginning, full body checkup. Very important. I have another question for you. Are you ready to prioritize yourself, to put yourself first, to be serious about your health and your life? If the answer is yes, congratulations to a long, healthy, and fulfilling life. Remember, you matter. It is time to accelerate action. Happy International Women's Day. Thank you.